Thank you. Right. Hello and welcome to this May meeting of the Derby Health and Wellbeing Board. It's lovely to see so many people here in attendance, and we have a very interesting meeting this time, mainly focusing on child poverty and poverty, with some interesting important reports to follow after that. So, do we have any apologies?
Yes, we have apologies from Emma Aldred, Lucy Allen, Jim Ostring is covering, Nav Sahota, Clive Stanbrook, Pam Thrindahl is covering, Sue Ann Lim and Sharon Buckby, and that's all.
Thank you, Lindsay. And just very quickly, thank you for everybody who's engaged with our emails about the membership of the board. It's really lovely to have the responses and to get the confirmation of who is attending and who will continue to attend. So that's really helpful. Thank you very much. There are no late items. Are there any declarations of interest? No, thank you. Are we all happy to accept the minutes of the meeting on the 13th of March as a true and accurate record? Yes, I see nods around the room. Thank you very much. And I just very quickly looking at the action log. There are items in progress there. A few items are completed. I know Councillor Hezegray, you might be concerned. You did ask for that item regarding children's gambling to come to this meeting, but we because of the focus on child poverty, we have, I think it's going to be in the July, it's scheduled for the July meeting. So are there any more comments on the action log? Everything's either completed or in progress. Thank you very much. So now, very swiftly then, moving swiftly on, I'm very pleased to be able to introduce Sophie Howes, who's come up from London today, correct, to talk to us about child poverty. Sophie works for the Child Poverty Action Group, and I'm really pleased that she's been able to join us today. So she will talk for 20 to 30 minutes, and then we'll have lots of time for questions afterwards. So over to you, Sophie. Thank you.
Thanks, Alison. And thanks very much for the invitation to come today. Just a bit about me and about Child Poverty Action Group. So I've worked at CPAG for about 7 years now, but prior to being in this head of policy role, I worked in a range of sort of frontline community mental health and domestic violence services, and felt quite sort of motivated to work in the poverty space off the back of kind of working with a lot of different people where it felt like poverty was this kind of foundational issue that was leading to many of the other issues that were cropping up in their lives. So it's really, really interesting to sort of be here and get the chance to talk about this in a sort of health context, because I think the links between the two are really kind of fundamental to understand, I think. Hopefully people have heard of the Child Poverty Action Group. We're a charity that was founded in the 60s by a group of social workers and academics who were concerned about high levels of child poverty then, and we are unfortunately sort of approaching our 60th anniversary after being sort of set up to try and end child poverty in the UK. So still lots of work to do, which I'm sure you'll understand. I work in the policy research and campaigns part of CPAG, but we also have a large welfare rights team, which are responsible for producing a range of resources, one in particular, which is the Welfare Benefits Handbook that's used in kind of every Citizens Advice bureau across the country. So we're a kind of leading second-tier welfare rights service, as well as an organisation that campaigns to end child poverty. I'm going to go to the next slide, if that's okay. I'm going to talk briefly through these headings that are on the slide. So I'm going to start off with a bit of an explainer around child poverty, which I'm sure everyone in this room will be fairly familiar with. But I just thought that would be helpful context to some of the discussions we'll go on to have. I'm then going to talk about the trends in child poverty. So really understanding what's happened to child poverty over the last sort of 15 to 20 years, and then also looking forward to what we're expecting child poverty to do, particularly in the absence of any further action on child poverty at a national government level. And then finally, I will talk about what we can actually do to tackle child poverty. The good news with child poverty is that it's highly sort of policy responsive. It's actually something that does really respond well to policy interventions. So when it is prioritised within governments, at both a sort of national and local level, you can really see results. So I'll talk a bit more about what's at the top of our kind of sort of shopping list of policy asks as an organisation. And as Alison said, there'll be plenty of time for questions and discussion afterwards. Okay. So I just wanted to start off with the sort of basics really around what poverty is, which, I feel like I'm talking to an audience that knows this stuff really well. But I guess the reason I highlight it is because I think you do have to have a shared sort of problem definition. You have to agree on what you think poverty is, because, people do actually have different kind of views or conceptions of poverty, but the definition that we use at CPAG, and there's a kind of widely accepted definition, is from a sociologist called Peter Townsend, who is one of our founders. And you can see from this quote on the slide that he's very much talking about poverty in terms of resources, so the kind of financial resources to participate in the society in which you live. And I think that it's important to highlight that we are talking about, we're talking about income, we're talking about family income when we talk about poverty. And so any policy responses to tackle child poverty really need to be looking at how we can actually increase household income to lift children and families above the poverty line. In terms of how we sort of measure child poverty, again, this is there's a sort of range of different definitions that you can use to understand both poverty and child poverty. But the measure that we use as our sort of primary measure of child poverty at CPAG, and is kind of widely accepted within government as well, is the relative after housing costs measure of child poverty. So just to sort of break that down a little bit, the relative part is really around understanding poverty in the society kind of in which you live. So just sort of reflecting back on the quote from Peter Townsend, where he kind of talks about understanding poverty in a context that you do, and that's really about recognising that the resources that we might need to participate in the society in which we live change over time. So 20, 30 years ago, not having a mobile phone would not be a major issue. I think today, we'd all recognise that in terms of your ability to participate in the community you live and access services and all of those things, actually that's very difficult if you don't have a mobile phone. So it's kind of relative to the society in which we live. And then the after housing cost bit is to ensure that housing costs are reflected within the definition. So the government publish annual poverty stats, and they will publish stats which show before housing costs and then after housing costs, and we're sort of most interested in the after housing costs bit because housing is an unavoidable cost for families. The benefit of doing that is that you also see regional variances, which is really helpful for understanding the sort of drivers of poverty and how they vary at a regional and local level. It will not surprise you that, high housing costs is a major issue in London. It's not the main driver of child poverty in the northeast, for example. So different parts of the country will have different things which are particular issues and problems for the families in that area. So that's really important. So sorry, something I should have said when I was talking about the relative aspect of this measure is that that is pegged at 60% of median income. So it's basically we're looking at median incomes across the UK, and the poverty line is basically defined as families who are living at, whose household income is below 60% of that median income. And so that's how it sort of changes over time as incomes rise because of kind of inflation and cost of living. Rising over time, that poverty line will kind of increase to show that the costs that you have, they obviously go up over time, and so the money that you need to meet those basic costs changes. Okay, so I want to talk briefly about the drivers of child poverty, because again, I think, going back to my point about having a good understanding of the sort of the problem and defining that problem, it's really key that we sort of understand what is causing child poverty, and also why children and families as a sort of demographic group are more at risk of poverty than other parts of the population. It's one of those, yeah. So as I said, household income is really, really critical. That's what we're looking at when we look at poverty. And there are two key ways that household income can be addressed. One is through earnings, so through employment. That is a major way of kind of getting money into the household. And, that has been a huge focus of, I was going to say kind of the last government, but actually the governments before it, it's been a real focus over the last sort of 15 or 20 years is around increasing employment. And some of that work has been highly effective. If you look at the rates of kind of out-of-work families in, say, the mid-90s to now, that proportion has dropped significantly, actually. So we have a far lower number of families who are kind of entirely out of work. What that has meant is that we have seen rising numbers of families who are kind of in work, so the rise of in-work poverty. So people who are working in employment at some level, but they're still below the poverty line. I'm going to talk a bit more about that. So earnings is a kind of a way of sort of putting money into that pot so that you can meet your costs. The other key source of income for low-income families is social security, so benefits. And so I think particularly in the sort of public narrative and sort of media narrative around poverty is that people conceptualise there are sort of people on benefits over here, and then there's people who are kind of earning and, over here. And they don't really see them as the same group. But I think it's just really, really important to understand that for the majority of low-income families, they will actually be doing both. They'll be working a bit and they'll be claiming benefits. You can claim universal credit if you are in work, and huge numbers of families are doing that. So it's both earnings and social security that low-income families rely on. And part of the reason that they rely on sort of both of those things, sorry, if we could just click through to the next one, is just that families with children have sort of higher costs than other groups because their housing costs will be higher because there's just more people in the house. They will often be paying for childcare, which is really expensive. And then actually all other bills go up when you have kids. So, food, utilities, all of those things. And wages don't adjust for family size. So families can be working, and we work with many families, particularly single-parent families, where that parent will be in full-time work and they'll still be living below the poverty line because the costs of children cannot be matched by employment on their own. So that's why the benefit system becomes really, really critical in sort of propping those families up and making sure that they can meet those basic costs. So when you see changes to the benefit system, families are really, really susceptible to those changes because they really rely on that support. And that will be relevant as I kind of talk through what's happened over the last 20 years or so on child poverty. Thank you. Okay. I wanted to explain briefly who, sort of within the kind of wider cohort of families with children, which families are most at risk. I'm sure it won't surprise you that these groups are kind of on the slide. And again, it just goes back to those drivers of poverty that I was just talking about. So children in single parent families, again, you only have one potential earner in that household, so that pot is already reduced in terms of earnings. And as I said, we work with lots and lots of single parent families who are working full time and living below the poverty line. There's not much more that they could be doing to get money into the household. Children from black minority ethnic groups are particularly vulnerable to poverty, and that will be around both kind of higher barriers to employment, issues around discrimination. Also, if you look at kind of the sort of demographic profile of black minority ethnic families, you will see more families with more children, so 3 or more children, and so and that's another risk factor that I'll talk about in a second. Children in families with a child under 5. Again, this correlates with a time in parents' lives when their caring responsibilities will be greater. And that's something that I should have said, sorry, when I was talking about the drivers of child poverty, is that increase in costs that you get from having kids comes at a time when your participation in the labour market goes down. So, you know, it's the sort of double whammy of, like, you need more money to cover those costs at a time when, you know, often you might have one parent out of work for a year on maternity or paternity leave, and often parents are working part-time to try and manage the caring responsibilities that come with kids. And that's obviously more acute when your children are babies in preschool. Children in families with 3 or more kids, again, those consumption costs go up because the family has more people in the family. But one of the major drivers of poverty in this group has been some of the changes to the benefit system that we've seen over the last 10 to 20 years, which I'll talk through in a second. And then children in families where someone is disabled. Again, you know, their participation in the labour market may be quite limited as a result of a parent having a disability or a child having a disability, which then requires a parent to be stepping out of the labour market to care for that child if you know, suitable childcare can't be found. So that's just a quick run through of the sort of families that are most at risk. I wanted to talk about what's happened to child poverty over recent decades and what we are expecting to happen going forward. So this slide just gives you a sense of the sort of direction of travel. Essentially, what we've seen, so I think the sort of main message to take from this slide is that child poverty is policy responsive, and when you have a government in place, particularly at a UK government level, that makes child poverty a priority and invests in tackling it, then it falls. So in 1997, the Labour government was elected, and there was a strong commitment from both Tony Blair and Gordon Brown that ending child poverty was going to be a real priority for the new Labour government. And so we see investment in particularly things like the establishment of tax credits, which had a huge impact on child poverty. And in the period between 1997 and 2010, we saw over 1 million children being lifted out of poverty during that period, which is one of the biggest kind of decreases in child poverty in a G7 country that we've ever seen. What you then see is child poverty starting to kind of tick up again. As we get in, there's this kind of change in government, and then this sort of austerity era, and so there was obviously cuts across a range of different areas of government, but we saw huge cuts to the social security system, and that because of what I was just saying about children and families being quite vulnerable to any changes to the benefit system because they're really reliant on that income, we see child poverty going up. You might be wondering what that kind of V shape is around 29-20. That is the temporary increase to universal credit that happened during COVID. So that was huge for child poverty. So it was £20 a week was given to households that were claiming universal credit, and child poverty fell quite dramatically. So I think, you know, it illustrates that child poverty is, as I said, policy responsive, and the role of the social security system is really critical. Child poverty is going back up. So today we have 4.5 million children living in poverty in the UK. That's the highest numbers ever. So 31% of children. And we are, at CPAG, we've sort of modelled the numbers around what will happen to child poverty going forward if we don't see any sort of action from a Westminster government on child poverty. Sort of if everything remains the same, then child poverty will reach 4.8 million by the end of this Parliament. And that is primarily due to the rollout of the two-child limit, which I will talk about in a bit. Okay, so I just wanted to sort of contrast the slide that I just showed you, which was that kind of trajectory of child poverty rising, and this slide, which just shows the fall in social security spending. So, you know, you'll all be familiar with the kind of quite drastic cuts across government, which included the social security system from about sort of 2010 onwards. Sorry, there's one more. We calculated that pre-COVID £36 billion had been taken out of the social security system as a result of government policies that have been implemented since 2010. We think that figure's about 40 billion now. So huge volumes of money have been stripped out of that system, and children and families have been very much at the kind of brunt of feeling those cuts. Next slide, thank you. So, what can we do about it? So, I wanted to just sort of tackle head on the issue of there being sort of no money to address this problem. So the reality is that tackling child poverty effectively does require resources. So it requires that investment in the social security system. It requires investment in a range of other parts of government as well. So I'm going to talk about that in a second. If you really want to see that sort of cross-government approach, we'd want to see action on housing and childcare and preventative services and all of those types of things. And that does require money. Obviously, the kind of political bind that the current government is in is that there are kind of no resources, and I think it's just worth highlighting how we sort of stand internationally when you look at levels of taxation in the UK. And I think at CPAG we would want that to be more part of the sort of public debate about how we tackle both child poverty and sort of investment more widely in public services, is how we can make sure that there are the resources to do those things effectively. And why should we do that? I mean, I don't need to tell this audience how critical experiences of poverty are, and how critical they are for children, and particularly in like early years. You know, the evidence is just really, really strong that this stuff is a huge determinant of both its educational outcomes, health outcomes, life expectancy. All of this stuff is really, really affected by experiences of poverty. So there is a huge sort of incentive, I think, in terms of meeting a range of other sort of policy objectives outside of just tackling poverty. I guess the other thing to mention is the sort of cost of not doing anything. We did some research at CPAG around the cost of child poverty to public services, and calculated that it costs about 39 billion in terms of you know, increased hospital admissions, increased cost to adult social care, increased costs within the criminal justice system, reduced revenue from taxation. If people are kind of out of employment and they're not paying taxes, the government's having to spend more on benefits if people are poorer. So There's lots and lots of ways that money is spent across government, sort of picking up the pieces of child poverty. Okay, thank you. So what are our sort of priorities in terms of the investment that's needed? I've talked quite a lot about social security, and we would really see that as like the foundational pillar that needs to be addressed first. So there are two policies that have been particularly harmful for children and families. When I talked about that, the scale of cuts that we've seen across the social security system, that has been in a range of different ways. So there's things just like things that have affected everyone on benefits. Things like freezing benefits is really harmful. But the two policy measures that were introduced by the previous government that have been really, really punitive for families has been the two-child limit and the benefit cap. So the two-child limit has, there are now 1.8 million children affected by the two-child limit, and the reason that that poverty sort of line is increasing, and we are predicting it will carry on increasing, is that more and more children are born that are now newly affected by the two-child limit. So it came into effect in 2017. So it was all third or subsequent children that are born after 2017 are affected by the two-child limit. So that's a major driver of child poverty. The benefit cap is another policy which affects families who are either out of work or are working not many hours. So it's families who are working less than 16 hours. And it caps household income. So it caps it to a certain level. So in London, that's £26,000 a year. Outside of London, it's 23,000, which sounds like a reasonable amount of money. But I think what's really important to understand is that when you look at benefit capped households, there's the vast majority of that is being spent on housing. So we did some analysis of benefit capped households in London who, once they had paid their rent, a single parent with three children was expected to live on £45 a week once they paid their rent. So there's just no way that you can meet the costs of children on that money. So families affected by the benefit cap are living in very deep poverty, very far below the poverty line. So those are two really regressive policies that would be sort of top of our hit list of things that we would want to see action on from the government. But in addition, we would like to see investment in child benefit, which is a very effective policy tool in terms of tackling child poverty. It has really high levels of take-up because it's very easy to claim. It kind of sits outside of the universal credit system, so families who may not have, there's a whole process that goes with kind of claiming universal credit and conditionality and lots of things that can make it feel like a system that's quite hard to engage with, whereas child benefit is a much simpler process that you can just make an application when your child is born and they will be eligible for that benefit until they're 18. And increasing child benefit would make a huge, huge difference to child poverty. So those are our things that we would want to do in the context of social security. It's not just about social security. There's lots more that needs to happen on child poverty. And one of our sort of secondary call for many years, has been around implementing a cross-government child poverty strategy. And that's what we saw under the previous New Labour government that was very effective at lifting children out of poverty, is that they had a cross-government strategy that was investing in social security, but it was also Sure Start. It was doing lots of other things. It was investing in childcare. And so that's what we would like to see, and the good news is that we are about to get one of those. So you're maybe aware that the government is due to publish a child poverty strategy at the end of June, so it's coming very soon. We think, and I think the government is broadly aligned with us on this, that an effective child poverty strategy does need to address all of these areas. So social security, housing, education, employment, childcare, and then a bit of a catch-all sort of services for children and families, which we would consider particularly preventative health services being part of that. And so there's lots that national government need to do in this area, but there is, I think, lots that can happen at a local level as well, and that will be a really interesting part of the strategy is how Westminster sees local government as a sort of delivery partner in this, and also the extent to which, if they do see an active role for local government, how much that is resourced, because that's something that CPAG has been saying very strongly since they announced that they would have a strategy, was that we thought that local government was a really critical partner, but that placing further obligations on local government without resourcing it was going to be really, really tricky, particularly in this context. So, yes, we wait with bated breath to see how much they've understood that message. Yes, so I'm pretty much done. I did just want to finish with a few quotes from families. So we did a series of interviews with families that were affected by the two-child limit and the benefit cap in the summer of last year. And I just wanted to include a few quotes about their sort of day-to-day, really. I'm sure none of this is new, and you will know of families that live in this area that are in very similar situations, I'm sure. But I thought that these quotes just really help to illustrate the wider impacts of living in poverty, both for parents and for children. Some of those impacts are health impacts. Some of those impacts are broader. But yeah, I just felt like these quotes really illustrate what I was saying before about experiences of poverty being so critical in determining childhoods, but then future sort of life outcomes as well. Go to the next one. This is another quote from a family. And I guess just to something I haven't spoken about, but is going to be increasingly part of the picture, is what's coming down the road in terms of changes to disability benefits. So lots of children living in families with disabled parents, and unfortunately life is going to get a lot harder for those families. And then one final one. Okay, I think that's me done. But yeah, very, very happy to talk a bit more about anything that was in those slides. I appreciate it was a bit of a canter through, quite a meaty policy area. Thanks, Alison.
Thank you, Sophie. Thank you. That was, yes, a tour de force, and that's very helpful. Thank you. It really sort of either tells us or reminds us of the overall scene setting for causes of child poverty, the key factors, how it swings and why there are, why it isn't sort of simply, there are some simple answers, but in other ways it's more complicated than that. And also some points about, very helpful points about where policy perhaps ought to go, and then also, hopefully what we can do locally. When I spoke to you previously, I talked about the fact that we have our own anti-poverty strategy, which I think Heather is going to talk about briefly. Not the whole strategy, is that right, Heather? It's not published yet, is that correct? So she is going to talk to us in a moment about our action in Derby, about what we can do, and that's important to us, about what we can do locally. But also, I think it is really critical that we never lose that bigger picture of where policy, national policy, is affecting a place like Derby, because we're just we're a very effective team Derby, if you like, to use the phrase that people use. There's a lot of people in Derby who are very, very keen to do what we can to help alleviate and help people, especially children who are in poverty. But we know that there's some bigger factors at play. So I find that really interesting. Really, thank you. So I'm now going to open it up for questions or comments. Councillor Kerr.
Thank you very much. One of the things I thought was most interesting there was your graph showing the way in which child poverty is varied over time, and it seems to be so inconsistent and unpredictable as to what it happens, which makes it as a parent, you've got things flung at you and instability within a couple of years and without any warning. And I don't think I've ever looked at it like that. You know, you just manage it. My children are now grown up, but you just manage the situation regardless. But not having to manage it and knowing that you've got stability, whether it's at a comfortable level or a slightly uncomfortable level or a generous level, as long as you're managing it and you've got consistency, it makes it a lot easier. I just wondered, in terms of getting some sort of stability and stopping politicians from changing their mind all the time, have you looked at citizens' income and what the impact that would have, and whether it would actually simplify the benefits system and make it a more stable situation for families?
And by citizens' income, is that synonymous, without a huge explanation, Lucy, if you don't mind, but is that synonymous with a universal basic income? Is that, yes, that the kind of thing? Thank you.
Thanks. Yeah, great question. I mean, I think I really agree with your point of, like, when we talk to families, lots of them will say, you know, it's the kind of unpredictability that makes things really difficult. And one of the things that kind of exacerbates that is universal credit. Universal credit is a system that can fluctuate quite a lot in terms of what people get. And so we have lots of families that say to us they feel like they don't really know that you receive a monthly payment with universal credit, and not really understanding how being in employment will affect their universal credit, sort of not knowing what that payment's going to be each month, and then having to sort of scrabble around to kind of get the resources that you need, in contrast to a system like tax credits, which was there was like an annual income assessment, and then you would receive payments on a very regular, stable basis that, as a general rule, I'd say families preferred, because it does provide that sort of stability. I think that's one of the reasons that we say that outside of getting rid of those really regressive policies, we think investment in child benefit is important, because it is a really stable payment that you just receive on a weekly basis. And, you know, you just know that you'll be getting that, and you'll get that until your child is 18. In terms of the universal basic income or citizens' basic income, I think it's a really interesting concept. Been watching the trials that have happened of UBI in different parts of the world that you might be familiar with, and one that's closer to home is the trial that's happening in Wales at the moment. And we will be getting results from that shortly, and that's been focused specifically on care leavers, so providing care leavers with a basic income. I think the reality is that delivering a basic income at scale would be costly. So I think for us, it's probably around what are the things that are appealing about basic income, and how can we mainstream that into the kind of wider social security system that's already operating, to make sure that those benefits are felt, rather than trying to establish a sort of separate system.
And I was Councillor Hazelgrave, and then Kim.
Hello, Sophie. I'm Paul Hazelgrave, the Cabinet Member for Children, Young People and Skills on the City Council. Thanks ever so much to you and all your colleagues in your organisation for the work you do on evidence-based advocacy of what's happening in terms of discussions with the government. And I think the case is unassailable for many of the things you've said. One of the issues we've discussed recently, and I don't know if you had a look at this, is the rollout of universal free school meals for primary children. And we are also concerned about the levels of obesity. I'm sorry to rehearse arguments and discussion that we had in previous meetings, but it'd be interesting if you have any information about what your stance is on that. I'm concerned about the quality of the food that's given. It's universal, that's great. So all children, there'll be no kind of stigma, all that kind of thing. But is the quality of the food and the variety clearly, because when I had school dinners, we all had the same one. I don't think we ever knew about allergies. This is back in the 60s and 70s. Nowadays, you have to have that range, and quite rightly. Are we going to get a quality of food that sustains the child, is nutritious and balanced, and makes sure they have the best start to their day's education?
Thank you. So CPAG supports the rollout of universal free school meals for primary school children. So that's another of one of our kind of key policy asks in the education space, because we do think it's really, really critical. It's a sort of a way of sort of accessing children on scale, and you know, it's sort of the only part of the school day that's means tested. Everything else in that education space is provided on a universal basis, but when it comes to this meal at lunchtime, that's something that is means tested, and the threshold for free school meals is extremely low. Hasn't changed over time, and you know, many families who are living in poverty do not qualify for free school meals. So we calculate the numbers for that each year, and it's 900,000 children living in poverty don't qualify for free school meals in England. So really high numbers. So we're supportive of the principle of universal free school meals. I really hear you on the policy implementation issues. I don't think they're insurmountable. You know, obviously it's about resources and how much resources are put in, what the costs allocated per meal is really, really critical. I mean, I think in a way, that's the sort of good thing is that there are sort of regions and areas of the country that have sort of gone their own way on this and have started rolling that out, and there's lots to be learnt there. So you'll know that universal free school meals for primary school has been rolled out in London, and there's really good evaluation data starting to emerge around, you know, how that's been done and where there's been successes and what the barriers have been. And I think you're right. I think, you know, that you don't want to be doing that, and then the deterioration of the quality of meals is the kind of the sort of net result. But I think it's kind of happening in enough places now that we can try and kind of work out how best to implement that policy. And I think we believe it's still kind of, despite those problems, something that's really worth pursuing, because I think it can be really, really critical for children.
Thank you. Just very quickly, we had some success on eligibility to free school meals, haven't we, Heather? I don't know if you may mention this later on, but Heather has run a project where we've managed to get many more children who were eligible onto free school meals in combination with a cabinet member. So we've had a little bit of success in that in Derby, but obviously we appreciate the children who perhaps would benefit from it who aren't eligible.
Sorry, I should have said, we are really hoping that there'll be something on free school meals in this forthcoming national child poverty strategy. So the conversations we've had with officials, I don't think, you know, I'd love it to be the rollout of universal free school meals for primary. I don't think it'll be that, but I think they may look at things like raising the threshold. So the threshold is very, very low. You have to have an income of $7,400 a year, which is very, very low. So whether raising that threshold would then mean more families would be eligible at least might be sort of one way of getting a bit closer.
Thank you. So it's Kim and then Robin.
Thank you, Chair. Thank you, a really interesting presentation. Recognising everything that you've said, sort of, you know, recognise nationally we do need investment. We do work really well together locally. I think one of the things we haven't always done is been able to follow that with funding, because that has been really tight, so I think that's really important. But from your perspective, have you seen positive impact, or at least less negative impacts on children and families in areas that have set out to work differently? We've often talked about health and wealth and Wigan, Preston, Greater Manchester, or if you look at the Marmot cities as well. You know, is there any evidence now that having a framework for working differently and rediverting funds at a local level has had an impact? And if that has, is there anything we can take from that here that we can build into our partnerships and working differently?
Thank you. Yeah, I mean, I think on a local level, I mean, I think having some kind of poverty strategy, whether that's a child poverty strategy or having an anti-poverty strategy, it sounds like you have here in Derby, like that's a really, really important sort of framework to be operating under. And I think where we see the kind of most effective action happening at a local level, it is under that framework of having a strategy. And, you know, I do think the sort of really big ticket items, things like the 2-child limit, do need to happen at a national level, and that will be quite transformative in every part of the country. But there is a huge amount that can be happening locally that I think can make a real difference. So, you know, I guess in terms of, it kind of really, it sort of depends on the area and what the sort of challenges are. So I think, you know, an area that we've been watching closely is the North East. So under the leadership of Kim McGuinness, the mayor up there, and, you know, she's established a child poverty sort of delivery unit and is doing some interesting work with the policy levers that they have, and recognising that, you know, some of that is it's more limited than what national government can do. But some interesting stuff on employment and childcare and housing that will make a difference. I mean, I think one of the key things is really understanding what child poverty looks like in your area. So, you know, back to my point about the benefit cap, if you look at the North East, you know, housing isn't a particular driver of child poverty there because housing costs are quite low. But really, really high numbers of families with somebody who's disabled. So, you know, understanding like the demographic of child poverty in your area, and therefore making sure that the policy responses are kind of speaking to that is quite important, because, you know, in London where the housing costs are really high, that would have to be really critical in sort of designing that. I mean, I think something that we've seen in different parts of the country that's worked quite well at a local level and made a big difference in the absence of some of those big ticket things happening that would really help to increase family income is work on sort of take-up of benefits. So there's lots and lots of families who just aren't claiming what they're entitled to. So we delivered a project in partnership with the Greater London Authority, which was in primary schools in London. And that was around having a benefits advisor in a primary school. And it was really, really effective in terms of getting women accessing advice, getting black minority ethnic families accessing advice who maybe are less likely to kind of walk through the door of a CAB, and also, you know, accessing CAB services is actually very hard now because of the demand they're under. And, you know, we got hundreds of thousands of pounds worth of money back to families in a really short space of time, in about 6 months. So I think looking at those kind of innovative ways of just delivering services a little bit differently can be quite transformative, and I'm sure there's lots of stuff like that going on here, but yeah, hopefully that's helpful.
Thank you, Sophie. So just before a quick, I bring Robin in as Robin's our Director of Public Health. I was just, the last few days, I've been on an NHS Confederation leadership course, and we did an exercise around looking at where you would put budgets if you had a budget. It was a very hypothetical exercise, but it was very based on statistics that they have about return on investment. Now, I don't like that term, but nevertheless, it was a very interesting exercise for the health colleagues in the room, because the massive biggest returns on investment were all in housing, education, employment. I mean, I know we know this. And worklessness, although all the teams rejected worklessness, we thought, well, that really ought to be delivered by those people who've got the expertise to deliver that. But so this, the point I'm making is the impact of poverty and the poor housing, and then these early years, they have this, the impact on the health system is absolutely phenomenal, and we seem to already have the statistics or the evidence, the research that shows this. So, Robin.
Thank you. Yes, it's not me, it must be the... thank you. And I was just having a look back, because I have a slide that I use in teaching the GPs every year around child health and public health. And it is a Child Poverty Action Group infographic that I've used, and I think just to remember there's the physical health impact of the poverty, there's the really clear mental health impact of the poverty as well. And some of the things that really jumped out from me when I saw this infographic were not just issues around the individual child, but also the anxiety and the worry that creates for the child when they see how the family's struggling as well, and the worry they have generally for their parents and their parents' mental health, and the impact that has on the child's aspirations and their hopes and dreams for the future, and where they feel able to thrive and to succeed. And we do have reducing child poverty as one of the areas of work for our integrated care strategy, and I think it is an area that we haven't necessarily developed particularly well, but we'll wait for Heather's input later. But I think it's certainly an area for more work. There has been considerable work locally around improving uptake of benefits, but I think there's a lot more generally that we can do around raising awareness around that. But I think there's also some work we can think around all of us as employers and as the anchor organisations in the area as well, just considering that actually there's a number of our employees who will be living in poverty, who will have children living in poverty, and it isn't other people, is it, that are struggling. So, and thank you for travelling to come and see us today. It's been really great. Thank you.
Thanks, Robin. I really, really agree with what you're saying, and I think particularly the sort of the narrative that plays out in the media. There's lots of that real othering happening of this is other people, but you're right. It's your colleagues. It's my colleagues. It's like actually lots and lots of people are really struggling in what people will see as good jobs. There's these quotes. It was from a series of interviews, and we interviewed single parents who were paramedics, who were social workers, who were working in job centres. These people with good jobs, but actually just the costs, and often it would be around particularly where a relationship has broken down. So you've had 3 children, in a marriage that you thought was going to last, and for whatever reason it hasn't, and then a parent is dealing with those costs on their own, and that's really, really difficult. So I think just understanding that's kind of all around us is really important.
Thank you. So before I bring you in, Councillor Kerr, do you have any other comments from anyone else? I'll bring you in again in a second if that's all right, Councillor Kerr, but is it just a quick comment on what was just said? Go on then.
Yeah, it's just a comment on the point, Sophie, that you made about where the information is provided, and your mention of approaching mums, particularly at school gates. And I wondered if there's any way in which health visitors would be able to be, who may be going into homes, will be also able to pick up some knowledge about the benefits system and be able to make an approach at that point, and whether there's any potential to do something within that. It's somebody within the NHS in Derby who are dealing with that. I think it's not a public health issue.
Thanks, Sophie. So I'll bring in, I think it was Margaret next. Margaret's from the ICB.
Thank you. When you were talking about return on investment, that horrible phrase, I think there's also a massive societal impact on all of the issues that come out of child poverty. But the one I think that's very prevalent at the moment is the declining birth rate, because people looking at the impact of the cost of housing, the cost of childcare, the impact of maternity leave or part-time working, are deciding how many children to have. And we can see a declining birth rate having a real impact on all the issues for our growing elderly population, as we don't have enough people to look after us. So I think the impacts are both local, I think they're national, and they are the whole society. So I'm just really glad you came to talk to us. Thank you.
Councillor Ashby.
I just wanted to say thank you for, it's been a concern for us here in this chamber for a long time, but you've brought out the the facts of it and the reality of it so well. So just thank you, because I think what your presentation today, I'm sure has impacted all of us, and I think will impact us going forward as we think about what we do here in the Health and Wellbeing Boards and in other parts of the Council. So thank you very much.
And if there are no further comments at this point in time, it's a very nice link that you just said, Councillor Ashby, to bring in Heather. But I will thank you, Sophie. It's a really excellent presentation. It is an ongoing concern, and we are determined to do what we can locally and to take forward or take away as well your messages about national policy. That is also extremely important, but we are determined to do what we can locally. And so at that point then, and you're able to stay with us a bit longer, aren't you? Thank you. So that's lovely, because Heather Greenan and Jenny Wizard from Derby City Council are going to talk to us now about action to reduce poverty and its impact in Derby. Thank you.
Hi, can everybody hear me? Yeah, brilliant. My name is Heather Greenan. I'm Director of Corporate Management here at the Council. I'm here with my colleague.
I'm Jenny Wizard. I'm Policy and External Affairs Officer, and I work in Policy and Insight team.
Brilliant. So we're here to just give an update in terms of where we are with our poverty strategy, anti-poverty strategy. I know we keep perhaps changing around the terminology, and either way, it won't be called that. I think through this process, I think what we've learned is that language is really important. And certainly when we did a community event just last night, in fact, it's really important that we pitch this in the right way. So that is one of the things that we have consulted on in terms of what is best to call this. But ultimately, it is our approach as a city, as a partnership to tackling poverty and inequality in the city. We can perhaps just give an update. I did just want to say it was a really interesting presentation from Sophie, so thank you very much for that. We have, I think in our work, we have used quite a lot of materials from the network actually to really kind of build our approach. So thank you for the good work that the network does. So thank you. So I think as Health and Wellbeing Board is really aware, because you have been on the journey with us, it is about moving from the kind of the short-term cost of living crisis that we saw out of COVID into recognising this is a long-term issue. As Sophie's graph, I think, illustrated really, really well. And I think we've moved from that kind of, short-term focus to actually how do we come together to work in a preventative way to be tackling these issues. So over the last couple of years, I think, that those sort of emergency measures we have moved very much into, okay, how do we think about this in the long term? How do we get underneath this? So that has very much driven our partnership approach to tackling poverty. A few years ago, we set up the Poverty Commission. We have an action group that underpins that, and regularly we come along to Health and Wellbeing Board because we need to work together as part of that overall approach. So what have we done? So certainly kind of a couple of years ago, we as a council, Derby City Council, adopted the socio-economic duty. And that is one way in which we can make sure that we are embedding our approach to tackling poverty into our day-to-day decision-making. And we've been on a bit of a journey in terms of how we are addressing that, but that is now really firmly embedded as part of our equality impact assessment process. And actually, over the last few months, we have undertaken further training involving members of the community to help us embed that. And it's worth saying that our equality impact assessment, so it reflects the socioeconomic elements, but it also includes care experience, which I think is a really important part of this. We've tried to take an evidence-based approach, and I think as we've developed over the last few months, we've certainly recognised the importance of tools such as Policy and Practice, the Low Income Family Tracker tool, which we've had access to since November. And that is a real game changer in terms of being able to target interventions and funding towards particular cohorts of people in the city. Certainly we've used that approach around pension credit. That was one area that we have focused on, and that has delivered real benefits. So actually, we've been able to kind of see since November what that impact has been. And whilst I think there's still a bit of catch up around some of the data processing, our dashboard is saying that actually we know that there's 128 pensioners in the city that now have access to pension credit that didn't previously. So that, in terms of benefit, is actually worth £478,000. Over a lifetime, that could be 3.2 million. So, just with one small intervention, we can see in the same way, we were talking about free school meals. Now, actually, the ability to, we did some targeting, we looked at eligibility, we undertook the auto-enrolment process that identified 513 families in the city who weren't getting free school meals that now are. So it's that kind of approach that if we can take on a regular basis actually will bring real dividends. So certainly we're really excited about the LIFT tool and what it can do in terms of identifying households in crisis, but also that kind of wider approach around benefits maximisation that Sophie was talking about. And certainly there are areas such as carers allowance, attendance allowance, healthy start vouchers, some aspects of housing benefit, that we can target and just make sure that everyone is actually getting the income that they're fully entitled to. I think what we've also recognised as part of this approach to tackling poverty is that community engagement is critical. Certainly the event that we held last night, where we had it was around over 30 people actually, half community, half officers. Basically we asked them directly what they thought of the poverty strategy aims and priorities and what they would like us to prioritise in terms of actions. So we've got some really valuable feedback that we want to take forward as part of that. So, just in terms of where we are with the poverty strategy aims, I think we have shared a previous draft with the board, so this is just a bit of a recap, but our aims are focused in 4 areas, so the 4 Ps, as we're talking about, so protecting, preventing, the pathways out of poverty, and promotion. So we have looked at quite a wide variety of other poverty strategies and good practice to just help us shape those aims. And certainly we've done the same in terms of the priority areas. And the engagement that we've undertaken over the last 6 months really has enabled us to focus on, we feel that these 5 areas are the ones that actually will make a difference. And actually, in terms of the areas that Sophie was talking about, these did resonate. So child poverty absolutely being one. Appreciate that is quite cross-cutting. But the other areas in terms of housing. So we know that there's real opportunities to improve the quality, the availability of housing. We know we've got, significant numbers of people at risk of homelessness. And those in temporary accommodation. Skills, improving skills, education is fundamentally the way to enable local people to get some of the great jobs that we have in the city with our employers, to up income levels, and health clearly is a massive priority. We know that inequalities in the city, healthy life expectancies, there are large gaps. And then finally, the area is around financial inclusion. So we know that debt levels are going up. So actually the ability to provide direct support to people to just help them become more financially resilient is key. So those are the 5 areas that I guess are forming the strategy. What we're currently doing at the moment is kind of action planning against those. and consulting, as we have done. So in terms of engagement that we've undertaken over the last 6 months, just by way of a bit of a summary, really. I mean, predominantly the Poverty Commission alongside the Health and Wellbeing Board, you've been kind of steering us, but we did some very wide community events last year in terms of the Child Poverty Summit and then follow-up that was held, Youth Alliance in the autumn. We've made the offer generally to neighbourhood boards, and Jen, you went along to Normanton, didn't you?
I did.
And I think you've got another one coming up, haven't you?
Yes, I've got another one coming up. So
so-
yeah, we've done we're doing a wide range of engagement and really trying to ensure that we are reaching out to and talking to communities as well as to the partners and other public sector organisations to really build their views into this strategy. And we want that to be a continual process. This is not just something that will be fixed, it's something that we plan to have as an action plan as part of the strategy, because it seems to make sense. At last evening's event, we were, it was such a really powerful event in terms of the communities that we were engaging with were really appreciative of the fact that we were actually coming out to ask them to give us commentary. So really important. We've tapped into something there that I think we want to work with in the future and ensure that we build into the structure of the strategy going forward. I think the strategy can only go from strength to strength. I think we're looking at these 5 areas being sort of permanent areas, certainly for the City of Derby, because of the consistent evidence and stats that are coming up, and it's certainly been reinforced by the conversations we were having yesterday evening with residents of Derby. Housing being such a critical and crucial part of that discussion, child poverty being part of that discussion, but also some of you probably have come across it in your areas of work. Community cohesion and building community spirit and community capacity is also an underlying element of all of this. So, this is really important work, and I think being part of only sort of 20% of local authorities in the country that are actually doing child poverty strategies, I think it's the right way for us to be going.
So, how do we bring this to fruition? I mean, ultimately, we've undertaken a lot of research, a lot of engagement. There is a joint meeting taking place next week of the Poverty Commission and the Action Group to reflect on, I guess, everything that we've had so far, and to start to develop that kind of final action plan, which will be the commitments from all of the partner agencies. So we then wanted to kind of publish and publish the poverty strategy over the summer, probably June. I'm conscious it was interesting that Sophie referred to the child poverty I think strategy that's going to come out from government, because we have been kind of waiting for that. So, it's difficult to know should we wait until that actually happens, or should we just go with it. But I mean, ultimately, we have a plan, which is good. We do need to undertake just ongoing engagement, I think, about how interventions are working. Is there anything else that we can do? And that kind of continual monitoring process. And it's certainly worth saying that the City Partnership Board has a session in the summer around poverty and inequalities. And I guess what I hope is that the work that we've done around the poverty strategy can feature highly. And it's just getting that kind of wider input from the likes of business into, I think, getting behind it, because it is widely recognised that poverty, child poverty, are real issues in the city, and we need to address them. And just to come back to my kind of earlier point, it is about that kind of long-term view. It is about, our partnership theme as a city is about, tackling resilience and inclusion. So actually, it's how do we do that across the different strands of work that we have, between Health and Wellbeing Board, between, other areas that we're working in localities. We're all working for the same thing, essentially. So, but that's kind of a summary in terms of where we are. We're happy to take any questions.
Thank you, Heather and Jenny. That was really useful. I'm really looking forward to the publication of the strategy, but I totally agree that ideally you would have it, after the government's published their strategy, wouldn't you? So that, I mean, in the meantime, we're doing, you know, action continues, doesn't it, in terms of what we are doing.
Absolutely.
We continue to try and do what we can do. And I know increasingly when I talk to people in the city, I'm getting people from different groups, whether that's faith groups or other groups, saying they want to be proactively engaged and actually doing things for people, for families who are struggling. So I think there is a growing body of sort of potential volunteers who want to give their time to help, notwithstanding the need for national policy change. So do you have any comments or questions for Heather and Jen? Councillor Kerr.
I'd like to pick up something on the housing fronts, which I don't think we're talking about enough. The council has recently included in its sort of information online about Shared Lives Plus, which is being introduced with an organisation, a charity called Two Generations, and it's encouraging people to look at a solution by taking in a sort of lodger alongside their support in the community. And I think we need to be talking about it more. And I don't think it's just that scheme. I think we should also be looking at how people can be lodgers rather than having to have their own accommodation, because it makes better use of housing within the city. It means that the person who is taking the lodger in is getting more income, and the person who is living there is probably paying out less income, which enables people to get out of this poverty catch. It means they can start to save for their own accommodation later on, which might be 2 years down the line. Is there anything we can do to explore that area and make it something that's more acceptable, and people will not reject it as being possible for them without knowing the facts about the financial implications or the benefit implications, which are broadly very little?
I don't know whether my colleague Andy might want to say a few words about that.
Thank you. So hi everybody, my name is Andy Appleyard, I'm the Director of Adult Social Care Services. So Councillor Kerr, the proposal that you're talking about is something that we had discussed within Adult Social Care Services and then have started to facilitate through the local area coordination offer. I think it's an incredibly helpful programme. It's not been as successful as it possibly could have been in other areas. It was born out of supporting people during the COVID pandemic, but it's certainly something that we want to push more across from adult social care. I think it's a real opportunity to try and support people to be able to remain in their own homes and not rely on council-led support. So in line with our new strategy, supporting people to stay independent in their own home in a community that they recognise. So we'll certainly be trying to do more in terms of two generations within adult social care. Can I just make some other comments, if that's okay? So really supportive of the strategy that you've developed, to hear about the issues that are happening nationally and to know that we're doing something locally in Derby is something that I think we should all want to get behind. We have been doing a range of different pieces of work across adult social care, and one of those over the last 12 months has been financial reviews, so ensuring that people are contributing effectively or appropriately in line with government standards for the care and support that they receive. We've had an imbalance, and that's something that we've tried to address. We've conducted in the region of 550 assessments to date, and 100 of those we've identified vulnerable people who draw upon care and support who aren't claiming all of the benefits that they're entitled to. So this programme is supporting and facilitating them to be able to go through that process with wider support from other colleagues across the council. It's certainly an issue that is affecting a wide range of people in Derby, and if I think about the strategies that we have, start well, live well and age well, poverty doesn't just affect children, it affects everybody, and obviously all of our children go on to be adults within the city. So from an adult social care point of view, really supportive of this programme.
No, just to say thank you very much, and actually that in terms of the Shared Lives Plus, that could be something that actually that we reflect in the action plan if that's already taken place. So thank you.
Kim.
Thank Thank you, Chair. I didn't say before, Kim Harper, Community Action Derby. I think to pick up on that point, actually, voluntary and community sector have been really involved in development of the strategy, delivery of the strategy, actually, and the actions as well, ourselves and lots of our members included. I think one of the things to remember is actually there's a point before that intersects with local authority and statutory provision, and the voluntary and community sector have a huge part to play in being the front gate, if you like. Heather knows I've said this many, many times. Before people get into statutory services and systems, actually it's neighbours, it's good neighbours, it's volunteers in communities, it's the work our local voluntary and community sector that can do. And at the moment, it doesn't feel that we're including that as much as we could be. It was very much happened during COVID. Hate to harken back to COVID, but actually, a lot of the system fell away. And I think how we continue to ensure that voluntary community sector and our communities are involved is really essential in terms of that planning. And I know, Heather, that you know this and you're doing, but I just think by the time somebody's moved into a local area coordination team, they're actually in the system. We've got to get them at the front gate, else actually this isn't going to be affordable or allow us to do this long term. Sorry, it was more of a comment than a question, Heather, but I just thought it was important.
That's fine. We absolutely recognise that, and that came across really strongly from the community event last night. So, thank you.
Thank you. I'm guilty of this today, actually, but Kim, would you turn your mic off, please? Thank you. Thank you for that comment, Kim. I've actually managed to leave mine on a couple of times as well. But thank you, yeah. And we have talked about that, haven't we? And I think post the AGM, and this is something I'm going to return to, and we'll look at it more systematically. Do we have any other comments for Heather or Jenny? No? Right, well, I'd like to thank them then for their work, and we still really look forward to the strategy and hearing updates, but I imagine that Heather is very open to receiving ideas for actions, proposals, offers, you name it. Yeah. Okay, thank you very much. Thank you. Okay, thank you very much for that. That was a really good follow-up to our previous discussions of child poverty and the point also when I was quite shocked to realise that in the last few years in Derby, child poverty had increased by 50% to 33%, which on the stats we've just given is now more, above average for the country. But from what you have said today, Sophie, it's probably, given the national trends, it's probably not that surprising. But so thank you very much. So now we will move on to, now for something completely different, as they used to say, to the Better Care Fund update 25-26 from Gamal. Thank you.
Thank you, Alison. Just by way of introduction, Gamal is Director for Adults Commissioning and Children's Commissioning Chair. So this is a short update on the Better Care Fund in terms of submissions that are jointly made and very detailed submissions by the ICB and the local authority as part of our required Better Care Fund returns to NHS England. Just for a bit of context, Chair, the returns actually fell during the period of 20th of March. It was required to be submitted, and certainly for the board, we submitted that return in consultation with Alison as the chair of the Health and Wellbeing Board. So the report is outlining the context of the priorities within the BCF fund itself, and the objectives are outlined within the report. And then there is a very comprehensive submission jointly made as a narrative report to NHS England, which is very, very detailed and comprehensive, that we work jointly on. And for a little bit of background context, we've strengthened procedures between ourselves and the ICB, working much more jointly on these returns, and governance has been strengthened in that space in order to, one, around the priorities and spend areas, and two, around the actual impact outcome of those that funding. A little bit of context in terms of the size of the Better Care Fund. So in total, the Better Care Fund is £43 million. And just some information for context, because I appreciate these returns are very, very detailed that we jointly work on. So a little bit of context, that funding and the priority areas for that funding is around social care assessments and the cost of care packages for residential nursing and community services. And in addition to that, it is also around timely discharge from hospital, because those two aspects need to work hand in glove in an integrated way, which is operating highly effectively within Derby. And then there are other contexts as well to be aware of to help with the preventative model in order to ensure and preventing unnecessary hospital admissions, supporting carers who are looking after loved ones, and also to do with funding for adaptations to houses so that adults and carers can live independently. So that's just a little bit of context in terms of the priority spend areas set nationally and locally. So in summary, Chair, is the detailed narrative submission has been made by the required deadline, and as I say, some of our approach to kind of jointly developing these complex submissions, it has been strengthened as well, or further strengthened, should I say. So in terms of that, the Better Care Fund was approved for 2 years by this board. This latest submission has been made. I'm happy to take any questions.
Thank you very much, and I'll remind the board that this is the Better Care Fund is something that formally sits as answerable to the Health and Wellbeing Board, and so the recommendation we have here is a more formal one in relation to this particular item, to approve the spend and performance objectives of the BCF 25-26 in line with the national expectations of the programme set by the Department of Health and Social Care, and to note the revisions and changes for 25-26 BCF. So we'll be requiring a sort of formal approval of that in a moment. But before I move to that, do we have any comments or questions? I've got Kim.
Sorry, Chair. I did say before, in terms of signing this off, as the voluntary and community sector haven't been involved in the discussions around this, it's something I've raised at this meeting before. I don't have the detail enough. I mean, I understand that it has to go in by the 31st of March, but in that sense, I don't feel able to sign it off as such from a voluntary sector perspective, because we just aren't involved in the discussions around Better Care Fund or where that funding is spent.
Yes, I note that comment. I think it's more to do with very happy to give anybody a walkthrough of the Better Care Fund if a group wants to do that, because that might be more effective. But I appreciate the community voluntary sector saying that they aren't close enough to the Better Care Fund. But as I say, for Health and Wellbeing Board and partners, very happy jointly to have a session to do a detailed walkthrough, or equally happy to have a separate conversation as that with any partners who wish to have a detailed walkthrough with kind of council officers and ICB officers as well.
Okay, thanks, Gamal. And I'll reiterate as well, Kim, post the AGM, the council AGM, this is something, the points of engagement we can look at more systematically. Thank you. Councillor Kerr.
I wanted to raise the particular section on the discharge improvement plan, because I think this is a really exciting area and could make a lot of difference, including with the community sector, and also below the community sector. What seems to be not mentioned in this is at the bottom of page 7, are the friends and family and the neighbours of somebody who's being discharged. So it talks about creating a multidisciplinary team for Derby and Derbyshire to take responsibility for individuals needing discharge from hospital. Why not home? Why not today? I absolutely love that vision and the terminology. And then to embed a culture and practice of trusted information sharing so we complete assessments outside of hospital. That sounds really nice. It's so much easier to assess somebody in the familiarity of their own surroundings rather than in an artificial position at a hospital and make sure these are strengths-based. So I love the terminology and the vision behind there. But we're not talking about the friends, family and community who may well be the people who can facilitate someone's departure from hospital and being able to get home again. So I don't know if that can be, make sure that that is going to be embedded in the action plan so that there is a way in which those people can feel truly included as part of the solution and not an add-on.
Thank you, Councillor.
Oh, and sorry, in addition to that, how are we going to know whether we're succeeding in doing this? Have we got current statistics? And how are we going to be monitoring the changes in outcomes and the direction of movement?
Well, from what I gather, we're going to be having a lot more talk about ROIs, or return on investment, but Jim's probably already totally across that, aren't you, Jim, I suspect? So would like...
Thank you. Partially over it. So my name's Jim Austin. I'm the Chief Executive of Derbyshire Community Health Services, but I'm also the Senior Responsible Officer for the Community Transformation Programme that has been to this board before, and a lot of this Better Care Fund, and particularly the elements around discharge, are tied up in exactly that piece of work. Now, what I can do is take a moment to make sure that we engage with families and neighbours and folks like that, because they are clearly an important part of it. I would say that it's not an omission by deliberate action. It's probably an omission because we're trying to get a lot into a small space. But I can take that away to make sure that's included within the programme. And as far as metrics go, there's going to be metrics all over this, because part of the return on investment is we will need to invest in order to get the benefit through, benefits for citizens, but also benefits to the bottom line for local authorities and the NHS.
Thank you, Jim, for offering to do that. And yeah, I mean, you know, for people like me who don't want to see everything reduced to a financial spreadsheet as such, I think, yeah, that's right. If we equate return on investment with effective benefits, then it does start to be very important as a decision-making tool. And I know you've been working very hard on this, Jim, and producing some good results, I think. So thank you for taking that away. Councillor Ashby.
Thank you. Thank you for the report, which is in many ways exhaustive. And I thought it did talk quite a lot about voluntary sector and family and working together right across the report. The discharge fund on point 4.1, and I do agree, you know, working on faster and better discharges is really important. I just wonder, one of the huge discharge gum-ups in the system always seems to be pharmacy and, you know, people waiting for hours and hours and hours for discharge drugs. So I did wonder whether any work has gone into, you know, getting the pharmacy. I saw last time I unfortunately had to be at RDH that the pharmacy has changed, the people running the pharmacy. But are there still enough people there to really speed up discharges so that people aren't spending hours either in the discharge lounge or on wards just waiting for their drugs? Was one question. And the other question, a little bit alongside what Lucy is saying, is somebody monitoring the length of time people get stuck in discharge lounges? Because for me, the two heart-sink parts of the hospital, obviously the worst is A&E, certainly in my own experience, but the second worst is the discharge lounge, which didn't exist back in my day, thank God, because I think they're horrendous. I can understand why they exist, but the manner in which they exist these days I don't think is very kind or humane or speaks much of really caring for people. So I would like to know whether there's going to be some monitoring around ensuring that people are getting through those parts of the system quickly. And finally, there's again lots of talk of, you know, keeping people at home or out of long-term care with the use of home adaptations and technology. So is there extra funding for this? Because there's going to be, you know, historically it's taken for an extraordinarily long time to get home adaptations and funding for things like stair lifts. So these are the gum-ups in the system I've been aware of for donkey's years. I'd like to know how they're going to change.
Thank you. I'm sure Jim will just see that as an absolute good opportunity to talk about all the good work you've been doing, won't you, Jim?
So I'll be really brief. But so I think you've raised 3 points there. One around pharmacy capacity within our acute hospitals, one around time spent awaiting the discharge, so waiting to get out, and then the third one around the cost shift that's required to sustain people safely at home rather than end up going to hospital in the first place. So all those 3 things are core tenets of the community transformation programme. And in fact, I was meeting with Andy Appleyard, who spoke just now, directly before this meeting, around the theory that we have here around the spend may not be in the right place today, and there is a cost benefit to move the spend upstream to look after people safely at home. That might mean spend with local authority or voluntary sector or a different part of the NHS, because currently that's invested in trying to deal with the capacity that's going through our acute hospital environments. And I'm conscious there are no acute hospitals here to speak today, and Michelle will speak on behalf of the whole system if required, but the metrics you're talking about are exactly the ones we're trying to remedy. And we will be coming back to this board and to others to talk through, the scale of the programme, the speed of when it's going to go in and how we're going to do it, because it'll take at least 18 months to run it all, but some will run quite quickly over the summer now to get stuff ready for winter. And you'll start to see some of those in there. On the pharmacy one in particular, it's one that's my bugbear too, because it feels like that should be something we could fix relatively easily. Of course, nothing is ever as simple as it seems, but when I spoke to Stephen Posey at UHDB, and similarly for the acute hospital in the county, they are acutely aware of that and are working on that as a resolution as well.
Thank you. Did you want to say anything, Michelle, or are you okay?
Thanks, Councillor. Just really to support what Jim said, really, in addition to the Community Transformation Programme, the Urgent and Emergency Care Delivery Board has a whole host of delivery plans as well, which underpin and support some of the community transformation, but also in some of the individual organisations in terms of what's in their gift to support waiting for discharge and some of those things that you absolutely mentioned. And just to say, in terms of this whole BCF piece of work, it's enormous. There's a number of different facets to this strategic discharge, and that operational side of discharge is really important. It's very important in terms of our winter response for our communities, and it has a number of groups that oversight this, both operationally and from an assurance and governance point of view. So lots of metrics, lots of people looking at this. Some of this stuff's looked at hourly, some of it's looked at daily, some of it's looked at more longer term than that. So can give full assurance that this stuff is looked at significantly by a number of different organisations and professions across the system, and has a huge focus from all of us. And we've definitely endorsed the BCF sign-off.
Thank you. So do we have any further comments on this? If not, can I ask the board to formally endorse recommendations 2.1 and 2.2? Do we have that endorsement? Do I need a show of hands? Do I ask for a show of hands, Alison and Lindsay? Do I need a show of hands, Lindy? Oh, yeah. So we'll have a quick show of hands. It looks like we have the endorsement. Okay. Thank you very much. Thank you, Gamal, for that report. I know that there's an awful lot of work goes on to this area span, but it does touch upon, as has been expressed, some really key areas to try and transform the delivery of the services in areas that matter to all of us. So thank you for that. And we look forward to, well, it's just going to be kind of rolling on, isn't it? Thank you. Right, so moving quickly on then. We have an update from Alison Wynne on the pharmaceutical needs assessment.
Thank you, Chair. Yeah, just a very brief update in terms of where we are with the pharmaceutical needs assessment and the kind of next steps that are happening fairly shortly. So obviously I've been to the board, I think, a number of times recently, just to give an overview of what the pharmaceutical needs assessment is and the requirement of the Health and Wellbeing Board to have an updated pharmaceutical needs assessment in place and published by the 1st of October of this year. So we're well progressed in terms of developing and compiling that, and hope to have a complete draft in place within the next couple of weeks, with the intent of the pharmaceutical needs assessment steering group having sight of that early in June to do that kind of final review and kind of get it in place, ready to go out to consultation. So the plan is to go out to formal public consultation around the 23rd of June. So give or take potentially a couple of days, but that's the intent of it going out to consultation. It has to be out for consultation for 60 days. So at the end of that period, obviously we'll review the feedback that we've had in relation to the consultation and incorporate that within the final version of the needs assessment. So in relation to the Health and Wellbeing Board, so when we go out to formal publication on or around the 23rd, we intend to obviously circulate it to all members of the Health and Wellbeing Board as part of that consultation process, so you have sight of that and able to provide feedback and input into that. And then we'll be bringing the final document back for review and final sign-off of the Health and Wellbeing Board prior to its formal publication. So that's essentially where we're at, Chair, and kind of the next steps. Thank you.
Thank you, Alison. Any comments on that? No? And I think the recommendations are that we note this, and also that we do agree to have a draft, receive a copy of the draft needs assessment. I assume that people do agree to that. Yeah. Okay, thank you very much. So our next item is the update from the Derbyshire Health Protection Board. From Robin Dewis. I think we had to just we ran out of time previously, Robin, and we just had to we'll just note these and move on. So this is good that we've got time to actually hear this report this time. Thank you.
Thank you. Just tentatively as to whether. Thank you. Yes, so the board last met on the 14th of March. It's actually due to meet again next Friday, and we've had presentations previously, updates around vaccination and immunisation and the screening programmes as well. And we discussed these at each of our Health Protection Board meetings. You can see from the paper the priorities that have been identified around vaccination and immunisation. And these have really been driven by either national priorities or by local outbreaks or national outbreaks that were experienced over the last 12 months. That particularly relates to the measles and the pertussis work that's a national priority due to the outbreaks experienced there. The human papillomavirus relates to cervical cancer and is part of the cervical cancer elimination plan that's also being developed. From both vaccination and screening perspective, there was confirmation earlier on this week that screening and immunisation will continue on their process of delegation. So the responsibilities around the commissioning of those will continue on the process of delegation to the ICB from April of next year. So we are continuing with that work to ensure that that is delegated safely. There's always also a conversation around infection prevention and control, and I know we've discussed previously that there are issues around the coverage of IP&C, particularly for the community, and this continues to be an issue that we are discussing and seeking a resolution to. The Health Protection Assurance Framework is a piece of work that was developed in the East Midlands by our health protection leads across the East Midlands, and is to support us in our statutory function as Directors of Public Health to be assured that all arrangements are in place around health protection. And it has been incredibly helpful, and each meeting we pick a different part of the assurance framework to review, and this review was around emergency planning and response, which which was reviewed very well, and great reassurance that the processes are in place. We will be reviewing communicable disease at the next meeting, and we did have our working group yesterday to consider where there might be any issues of gaps or areas that we need to consider improving on that. And we also review feedback from our subgroups. So we have a vulnerable population subgroup and also a subgroup looking at the implementation of the strategy. And then part of that is developing the action plan. And I hope at a future meeting, perhaps not the next meeting, perhaps at a later meeting, we'll be able to have that action plan so that we can show the board what's been developed through that. As I said, we're meeting again next Friday, but very happy to have any questions.
Thank you for that update. Are there any questions on Robin's report? No? Sure? Right, okay. Well, thank you very much for the update, Robin. It's good that you've actually been able to present it, and we're just asked to note the report. Thank you. So that moves us on to our very final item, 14 minutes before 3 o'clock, so that's very good. Which is the Health and Wellbeing Forward Plan. Over to Alison.
Thank you, Chair. Yeah, the Health and Wellbeing Board Forward Plan, I've just kind of listed in 4.2 the items upcoming or provisionally on the agenda for the next meeting of the Health and Wellbeing Board. I think, as you mentioned at the beginning of this meeting, Chair, we have deferred a couple of items that were going to come to this meeting to enable that focus on child poverty and poverty at this meeting. So that said, we have got quite a number of items, some of which are quite substantial, provisionally on the agenda for the next meeting. So I think we'll need a chat through at the agenda setting meeting in terms of kind of how we manage that. We've got a bit of a backlog, kind of quite a number of items due and upcoming both at the next meeting and future meetings. So we do need to have a bit of a look in terms of how we kind of manage the agendas effectively. But that's just an overview of things that we've got scheduled coming up, but I don't think we'll be able to accommodate all of them at the next meeting. So, yeah, we'll have a bit of a think about that. But yeah, and I think I've mentioned in the paper that if there's any other items that people wish to put forward to future items, obviously just drop me a line and we'll add them to the forward plan.
Councillor Heathergrave.
So just a question about, this is clearly kind of the forward plan for the next meeting. Have we got an overview of what the structure of the content of meetings will be over the year? I'm just thinking that there's a reference to children and young people's plan priority send and inclusion update. That's important that we all know about. But we also had to think about gambling among young people and what the response would that be. And I'm assuming that will come later so that work could be done on that.
Yeah, I think there'll be an element of that, Councillor Heathergrave, at the next meeting as part of Robin's DPH annual report update. So I think the intent is that there's an update on the current, an overview of the DPH annual report that's about to be published, but also a bit of an update in terms of where we are on some of the activity around gambling, which was the focus of the last meeting. And I'm getting as well that there'll be probably some forward thinking in terms of actually what does that look like coming forward. But actually, I hadn't quite had time this time around, but I'll perhaps put a plan for the coming year. And I think that's probably what we can, part of what we do when we
have a
catch
table,
up.
don't you? So Alison does have a table with the sort of plan for items across the year, don't you? So she does have a strategic approach to this, that's for sure. Okay, thank you, Paul. Are there any other comments on this item? Oh, just very quickly, Alison, did we agree that Robin's report would be sent by email in advance of the meeting? I mean, in advance of the usual 1 week notification, because it's going to be published. Normally we'd have it to this meeting, then it's published, correct? But because of the meetings, because we've got so many items, we had to focus on the poverty today because that's when Sophie was available. Our plan is to publish, share with the Health and Wellbeing Board, and then discuss at the next meeting. Is that correct, Roman?
Yes, and next week we have the judging competition of the art competition for that, so we'll be able to get our final kind of important front cover and content, so then I think we'll be in a position to...
That's right. Myself and another councillor have been given the task of judging the children's art competition for the report, but the main thing will be that people will receive it in their inbox well in advance of the meeting, so that you are up to speed with Robin's report.
Yes, because it is quite a substantive document, so I think having it in full in advance of the meeting will be helpful. Thank you.
Right then, well, if there are no further comments, I'd like to thank you all for attending this May meeting of the Health and Wellbeing Board, and perhaps I will see you at the next one. Thank you very much.